Bismillahirrahmanirrahim. My affectionate students, Assalamu alaikum wa rahmatullah. Today I am going to discuss about absorption of drugs. Absorption is a process by which drugs are made available to the fluid of distribution. Drugs have to be reached to the fluid of distribution means blood. Before it reaches in blood, it has to cross biological membrane. Biological membrane is the cell membrane. All cells have more or less similar biological membrane, and that is known as unit membrane. The structure of the unit membrane is bimolecular lipid layer interspaced in protein layer. Maximum component of the cell membrane is made of lipid, bimolecular lipid layer made of lipid and interspaced in protein. So drugs that are lipid soluble, they can enter into the cell and they can come out from the cell by dissolving the lipid matrix. There is no bar for lipid soluble drug to enter into the cell, to go in or to come out from the cell. But for water and water soluble drugs, lipid membrane is a barrier. But we know that the cell components, more than 65% is water. From where this water comes. This water, for the entry of this water, there are Almighty gives pores to the cell membrane. There are 4 to 40 Armstrong diameter pores on the membrane, and through these pores, water and water soluble drug can go in, can come out, provided its size is smaller than that of the pores of the membrane. So this is the basic component of the cell membrane, that is bimolecular lipid layer interspaced in protein layer and with pores in between. Now, drug absorption. So drug characteristics is also very important. Drug may be categorized in three forms. Number one, drug, that is, they will permanently unionized, or they will remain permanently ionized, or in non-polar form, that is, they are always lipid soluble. And the drugs belongs to this group is digitoxin, then benzene, then steroid, then halogens, fluorine, bromine, iodine, and hydrocarbons. They will remain always in lipid soluble form, so they can easily enter into the cell. There is no bar for them. The second category, most of the drugs belong to this category. They are readily ionizable or readily unionizable in solution in body. Here, the important thing is, due to Henderson-Hasselbalch equation, when this drug is in normal, acidic drug in acidic pH remains in unionized form. Similarly, alkaline drug in alkaline pH media remain in unionized form. That means when the drugs and the media and the environment are in same plane, in same side, either acidic or in basic side, they will remain in unionized form, lipid soluble form, water insoluble form, and will be absorbable. But when on the other side, acidic drug in alkaline media or alkaline drug in acidic media, they will remain in ionized form, water soluble form, lipid insoluble form. They will not be absorbed, rather it will be excreted. If we give an example in case of stomach, and the drug is aspirin, we know the environment pH of the stomach is acidity of the stomach is very high, pH about 1. And aspirin, if it is given and if it comes in the stomach, then in acidic environment, aspirin will remain unionized form, lipid insoluble form, non-polar form, and it will be absorbed into the gastric membrane. But when this aspirin goes to the duodenum, where pH is towards alkaline side, will become acidic drug and towards alkaline pH will become ionized, will become polar, and will not be absorbed. On the other hand, if it drink an alkaline drug, when it comes in the stomach, then this alkaline drug in acidic media become ionized, will be polar, and will not be absorbed because it is lipid insoluble. But when it comes in duodenum, where environment is towards alkaline side and drug is alkaline, so it will become unionized, it will become non-polar, it will be lipid soluble. And maximum drugs belong to this group, that is, they are readily ionizable or readily ionizable according to environmental pH. And another category of drug, they will remain permanently ionized form. Whatever may be the environmental pH, they will remain in permanently ionized form. And the example of these drugs is acetylcholine, then atracurium, decamethonium, and aminoglycosides. Acetylcholine is a neurohumoral transmitter not used clinically, but atracurium, it is used as a peripherally acting muscle relaxant, and it is given by injection, it cannot be given orally because it is quaternary ammonium compound, not absorbed from the gut. On the other hand, streptomycin, member of aminoglycoside, used in the treatment of tuberculosis. It is also used by injection route, IM or intravenous route. It cannot be given orally, but can be given orally only for gut sterilization. But for systemic purpose, it must be given by injection route. So the drugs falls in three categories, may be permanently lipid soluble, mostly second category really ionizable or unionizable according to environmental pH, and another group is always remains in ionized form, polar form. Now I am going to discuss about the absorption topics proper. Now absorption, once again, absorption is a process by which drugs made available to the fluid of distribution, means blood, by crossing biological membrane. And there are various processes by which a drug can cross biological membrane. And the process is simple transfer. Another one is specialized transport. Simple transfer or passive transfer is subdivided into simple diffusion or passive diffusion and filtration. And on the other hand, specialized transport, it is categorized by active transport, carrier mediated, facilitated diffusion, then endocytosis and exocytosis. I am going to discuss about one by one. First thing, simple transfer. Some basic points of simple transfer. It is a simple phenomenon. It is a natural phenomenon. It needs no energy, needs no carrier. A very common phenomenon, very common phenomenon. And now, in simple diffusion, there are two criteria. One, it depends on two characteristics. It has got two characteristics. It is dependent on lipid solubility. Simple diffusion directly proportional to lipid solubility. More lipid soluble, more absorption. Less lipid soluble, less absorption. More lipid soluble means less water soluble, and that is an absorbable form. Then another thing is concentration gradient. Substance will move from higher to lower concentration. From one compartment to another compartment, drug will move according to due to concentration gradient. And more the gradient, more will transfer because they will collide. They will on collision each other, which favors movement of the drug along the gradient till equilibrium attains. So simple diffusion is a simple phenomenon, natural phenomenon, dependent on concentration gradient from higher movement from higher to lower, and it is dependent on lipid solubility, directly proportional to lipid solubility. This phenomenon is bidirectional. When one component, more drug goes to the another component having low concentration, till this process will continue till equilibrium. But in any region, another component when will be have high concentration, that will be again come back to other concentration where there is low concentration till equilibrium attains. Simple diffusion needs no carrier, needs no energy, it is bidirectional and it follows first order kinetics. Most of the drugs will follow this simple diffusion. For example, aspirin, paracetamol, diazepam, benzodiazepines, barbiturates, most of the drugs, alkaloids, will follow this simple diffusion because this dependent on lipid solubility and as well as along the concentration gradient. Now filtration. Filtration occurs. This is also it belongs to simple transfer. This is a simple phenomenon, and for this simple filtration, it is dependent. It needs two things. One is pressure, hydrodynamic pressure gradient. Pressure gradient is very important, and filtration occurs inside the body in all capillaries, especially top capillaries, that is glomerulus. Glomerulus is a branch of renal artery, which is a branch of abdominal aorta. Left ventricle ejects blood with high pressure that comes to the via ascending arch of the ascending aorta, arch of the aorta, ultimately abdominal aorta, and through renal artery goes to the glomerulus. And with this high pressure, it is filtered. So hydrodynamic pressure is more, then filtration will be more. When the pressure will be less, filtration will be less. This pressure will be increased in case of hyperdynamic circulation, in case of thyrotoxicosis, in case of pheochromocyte, in case of acromegaly, in case of pregnancy. With this high pressure goes to the glomerulus and favors filtration phenomenon. But when this pressure is decreased, as in case of diarrhea, dehydration, burn, heart failure, then filtration will be decreased. And for filtration needs filtering pressure and also a filtering membrane. And it is independent of lipid solubility. This is independent of lipid solubility. So this is and most maximum drugs is excreted from the body by glomerular filtration and tubular secretion, and also there is tubular reabsorption. In kidney there are three processes. One is GFR, tubular secretion, and tubular reabsorption. Tubular secretion is 10% active phenomenon. Glomerular filtration is 10% passive phenomenon, and tubular reabsorption mostly passive but also active. And most of the drugs excreted from the body by glomerular filtration as well as tubular secretion. And one of the important member is aminoglycosides that will be excreted from the body solely by GFR. So this is about simple transfer. Now specialized transport. And in specialized transport there are following groups, that is active transport, carrier-mediated facilitated diffusion, then endocytosis and exocytosis. Now active transport, here movement of drug occurs from lower to higher concentration, that is against the gradient. It is not natural phenomenon, it is a common phenomenon. It needs energy, it needs carrier. Energy facilitates this transfer from lower to higher concentration, and carrier is needed. And when carrier is needed, it has got no unlimited capacity. It has got limitation. It can accept the drug up to a certain limit. That means it has got transport maximum. And it will not accept all drugs. It will select some drugs. It is selective for some drugs. It is non-selective for others. So this active phenomenon, active process, it has got the characteristics of this is it is against the gradient. It is independent of lipid solubility. It needs energy. It needs carrier. And when there is carrier, because of the necessity of the carrier, it exhibits suitability as well as exhibits selectivity. And as it needs energy, so it is a quick phenomenon, a quick process. But simple process, simple transfer is a slow phenomenon. And this is, as energy is utilized here, so it is a rapid phenomenon, and it is not a natural phenomenon, it is not a very common phenomenon. Limited number of drugs are absorbed by active transport. As for example, glucose in intestine, glucose in kidney, then alpha-methyl dopa, levodopa, 5-fluorouracil, 5-bromouracil. These are the drugs absorbed by active transport. Also glucose, then also amino acids, also immunoglobulins, they will be absorbed by active transport. They will be absorbed by active at the cost of energy. They will be absorbed by at the cost of energy. Now, then carrier-mediated facilitated diffusion. It is diffusion, but it has to be facilitated. It has got some characteristics like simple diffusion, because that is, it occurs along the gradient and it needs no energy. But in contrast to simple diffusion, it needs carrier. Like active transport, it needs carrier, and for that reason, it exhibits selectivity as well as saturability. Now, carrier-mediated facilitated diffusion occur. Example is vitamin B12. This is cyanocobalamin. Its another name is extrinsic factor of Cassel. In our stomach, there is intrinsic factor of Cassel released by the pyloric enteral, and this intrinsic factor of Cassel complexes with extrinsic factor of Cassel, means vitamin B12, and form a complex. This complex goes to the terminal ileum, and from that part it will be absorbed. So, intrinsic factor facilitates this absorption, and this is carrier-mediated facilitated diffusion. When a patient is suffering from CA stomach, and if he or she has got gastric resection, then later on he or she may suffer from pernicious anemia and needs vitamin B12. So in that situation, vitamin B12 cannot be given orally because the stomach is dissected, so there is no intrinsic factor vessel. In this situation, vitamin B12 has to be given by injection route. Now there is endocytosis. Endocytosis means engulfment of droplet or macromolecules by the cell. Here it is of two types. One is solid particle drinking, cell drinking. One is cell eating. Cell drinking is phagocytosis and cell eating is pinocytosis. And it needs energy, it needs carrier, it needs energy, it needs calcium, it needs contractile elements. Not carrier, it needs energy. ATP is needed for this purpose. It needs calcium, and contractile elements are also needed for this purpose. Usually we give insulin subcutaneously, and from this subcutaneous space, the drug insulin slowly really comes to slow sustained absorption occurs, and it goes to the blood, and this insulin is absorbed by endocytosis phenomenon. There is another thing is exocytosis. Exocytosis is the cell at adrenergic nerve ending. There is synaptic vesicles. These vesicles contains noradrenaline synthesized within the adrenergic nerve, and this noradrenaline, due to its relevant stimulus, when nerve stimulates, then releases neurotransmitter at the synaptic cleft. How it releases? Here there is involvement of energy. There is calcium. Calcium goes into the nerve ending that allows the vesicles to move at the terminal end of the nerve, and ultimately vesicle membrane fuses with the nerve membrane, and ultimately contents come out with the help of calcium, with the help of energy. And this released neurotransmitter now acts on the receptor and produces the respective effect. So this is an exocytosis phenomenon. And at the same time, insulin is stored in beta granules, and when there is glucose is an important stimulus for release of insulin from the beta cells of islets of Langerhans, and before releasing insulin, calcium enters into the granules, and that causes movement of the granules. There is need of energy, and then the granular content fuses of the membrane fuses with the membrane, and ruptures and releases insulin. So this is endocytosis. So these are the specialized transport, and specialized transport needs energy, needs sometimes carrier, and if needs carrier, it gives selectivity and saturation, and needs calcium. In some situations they needs calcium and needs contact elements of the body. And this phenomenon is not a common or natural phenomenon. The less amount of drug, minimum amount of drug is absorbed by this phenomenon. But regarding glucose is a substance which is absorbed not only by simple diffusion, also by active transport and also by facilitated diffusion. Glucose entry into the liver is by simple diffusion, because in blood there is more glucose and that will enter into the liver, because in liver there is no glucose. When glucose enters in the liver, it is converted to glycogen. So there is no glucose in liver, so there is a gradient, and this gradient favors the absorption of glucose from blood to liver by simple diffusion. On the other hand, in GIT and in kidney, glucose is absorbed by active transport. At the cost of energy, sodium is needed also. And in brain or in adipose tissue, in muscle, glucose cannot enter into the cell unless there is carrier, and the carrier is insulin. That is the reason when in diabetes mellitus there is lack of insulin and the glucose cannot enter into the muscle and it will stay in the blood, producing hyperglycemia. So glucose is a substance absorbed by not only simple diffusion, active transport, as well as facilitated diffusion. Now there are some factors which can modify this absorption process. Now first thing is the state of the drug. Drug may be of various forms, maybe gaseous form, maybe liquid form, maybe solid form. Gases more absorbed than liquid, liquids more absorbed than solid. Among the liquids, solutions, homogeneous mixture is better absorbed than heterogeneous mixture. Then solution better absorbed than suspension and emulsion. Watery solution better absorbed than oily solution. Homogeneous mixture better absorbed than heterogeneous mixtures. Now regarding solid, while solids like tablet or capsule taken by orally, it undergoes first disintegration and then dissolution. Then that is means disintegration means disintegrates into granules and then dissolve into the gut fluids, and then after that it will be absorbed mostly by simple diffusion. So absorption, solid absorption depends on disintegration time and dissolution time. If disintegration time is more, dissolution time is more, then drug absorption will be delayed. But if disintegration time is less and dissolution time is less, drug absorption will be quick. So this is the physical state of the drug. Now important thing is partition coefficient. Partition coefficient means lipid solubility. Absorption is directly proportional to lipid solubility and indirectly proportional to water solubility. More lipid soluble drug, more absorption, less lipid soluble drug, less absorption. Then water solubility indirectly proportional to water solubility. More water soluble drug, less absorbed, less water soluble drug, more absorbed. So more lipid soluble means less water soluble, less lipid soluble means less water soluble means more water soluble. For absorption, the main criteria is lipid solubility, unionization, non-polarity, and for excretion, the criteria is water solubility or ionization or polarization. So, and the degree of ionization, more ionized drug, less absorbed, less ionized drug, more absorbed. Then concentration of the drug. If the concentration drug is more, there will be more absorption. If the concentration is more, there will be less absorption. More concentration, here the particles will strike each other, and that favors movement of the drug along the concentration gradient. So more concentration, more absorption, less concentration, less absorption. Then vascularity. More vascular area, more absorption. Less vascular area, less absorption. For that reason, during shock, hypovolemic shock or anaphylactic shock, where that leads to cardiorespiratory arrest. So in that situation, usually we give injection adrenaline, but usual route of adrenaline is subcutaneous. But if following anaphylactic shock, this adrenaline cannot be given by subcutaneous route. Should be given IM or IV, because in subcutaneous shock there is vasoconstriction. So drug will not be absorbed from the subcutaneous tissue. So that's why for prompt action we have to give adrenaline either by IM or by IV route. So then area of absorbing surface also important factor for absorption to determine absorption of drug, and this is most concerned with the GIT. In GIT, small intestine having extensive area for absorption of drug. There is villus, and there is crypt of liver cone, and there is brush border. So there is a huge area for absorption of drug, and with this huge area, maximum drug is absorbed from the intestine. Second area more is in lungs. So lungs is also good area for absorption of drug. And if there is resection of the small intestine, then drug absorption will be decreased. So these are the factors that, and now there is presence of second drug, which can also modify the absorption of drug. There are some agents which increases absorption of drug. There are some drugs which can inhibit the absorption of drug. Drugs that increases absorption is like vitamin C for iron. Iron, when we take in food, this iron is in ferric form, and in ferric form is more polar, it is not absorbed from the gut. So it has to be reduced to ferrous form, which is less ionized, and this conversion of ferric form to ferrous form is done by vitamin C, actually reducing agent. Also HCl in the gastric secretion. They will reduce ferric iron to ferrous form, and in ferrous form that will be absorbed. So vitamin C favors absorption of iron. Also sorbitol, it promotes the absorption of paracetamol. That's why sorbitol is used as base for paracetamol suspension. Then ergot, cafargot, we know this drug is very important drug for intractable migraine, resistant type of migraine. In this situation, this cafargot is very used, and cafargot contains caffeine and ergotamine. This caffeine facilitates absorption of ergot. At the same time, hyaluronidase enzyme, which also facilitates absorption of drug through the skin. So in this way, second drug can increases the absorption of first drug. Similar, on the other hand, there are other situations where drug absorption may be interfered or delayed, like iron with tetracycline, and calcium, magnesium, aluminum containing antacid will interfere the absorption of tetracycline. When there is a man suffering from lung infection, needs tetracycline capsule, and he is suffering from peptic ulcer, needs antacid, or he is suffering from anemia, needs iron. When they are used simultaneously, they will coalesce each other, they will trap each other, and then neither we get the benefit from tetracycline, nor we get benefit from antacid or iron tablet. So in this way, they will interfere the absorption of each other. Sometimes food, milk containing food, which interferes the absorption of iron, phosphate, calcium, milk contain calcium and phosphate, and they will trap tetracycline, so interferes the action of tetracycline. Cholestyramine, chelating agent, interferes absorption of drug from the gut. They will trap or they will absorb drugs from this to absorb. So in this way, second drug may interfere the absorption of first drug. Now, these